Hello, I'm Dr. Terry Simpson. Today, the new wearable devices come with a sleep monitoring function. Now, let's be clear, the sleep monitoring function isn't something that a physician would use to diagnose any sleep disorders that you might have, but it does provide you with some good and useful information. Let me give you an example. You ever wonder how many glasses of wine it would take between falling asleep and having a good sleep and not falling asleep and having a problem? Well, I wondered that. And I found out that while I was on vacation, if I had 8 ounces or less of wine, I slept just fine. If I had 9 ounces of wine, my sleep was profoundly disturbed. I discovered that my best sleep number was 30. I also discovered that if I ate before 3 hours of going to bed, I was fine. But if I ate 3 hours or less, I didn't sleep as well. I discovered that when I went from Phoenix to the East Coast, it took me 3 full days before I got a good night's sleep. When I went from China to Phoenix, it took me 2 full weeks before I got a decent night's sleep. I discovered that my son, when he sleeps in our bed, sleeps better, which means I sleep better. I also discovered that when my wife doesn't sleep well, neither do I. So these wearable devices or the iPhone apps that you can get by placing the iPhone by you are useful to get some good information for you and about your sleep. They are not useful for specific sleep disorders that need to be treated by a physician. So if you have chronic sleep disturbances, if you're falling asleep at the wheel of a car, you need to see a physician and get an adequate sleep study. But otherwise, these wearable devices are kind of fun. I personally, I prefer the iPhone app called Sleep Cycle. It gives me a lot of good information. For your doctor's orders and wishing you a good sleep, I'm Dr. Terry Simpson.